Our first speaker today is Anthony Jackson. Anthony Jackson currently serves as the Director of Prevention in the Division of Substance Abuse Services. In this capacity, he oversees all prevention activities for DSAS, including the prevention portion of the Substance Abuse Prevention Treatment Block Grant and administration of prevention activities carried out through the State Opioid Response Grants, Tennessee SOAR 1, 2, and 3. Prevention activities include supporting the tobacco, prescription drug, and alcohol prevention activities of Tennessee Substance Abuse Prevention Coalitions and Tennessee Prevention Network providers. Opioid overdose training to key stakeholders throughout the state through the Regional Overdose Prevention Specialist, or ROPS, developing a multi-model training program from healthcare professionals on the assessment and treatment of OUD, including DATA waiver training, ensuring access to naloxone in all the state's high-risk areas to high-risk individuals, and working to mitigate the circumstances related to opioid overdose outbreaks. Please welcome Anthony Jackson.
Good deal. Thank you, Scarlett. I always have this fear when I do these virtual things. Can people actually hear me and see me? So Scarlett, just give me a thumbs up if you can hear and see me. I just want, before I get going. Yes, and you can see my slides?
Yes.
Good, because I worry if I'll do it like where you can see the notes and stuff, or if it's the slide. So anyways, thank you, Scarlett. I appreciate it. Good to see you today. When Jack kind of was on that video, I just want to start off and talk about what Jack was saying. Is he's right. As much work has been done, my fear, my concern, and all of us have probably seen this, is where COVID has kind of undone so much of this work that we've done. So I'm hopeful that you'll take kind of heed Jack's words and really get something out of this, and I would say, as I present or others present, because maybe my presentation isn't the one that speaks to you, maybe it's someone else's. Think about, oh, wow, hey, I'm here for a reason today. What can I do? How can I get involved? How can I help? Because I think we all can. Is it by going and working for a program that does this work around prevention, treatment, recovery, or criminal justice services related to substance use, potentially? Or is it even just something you do on your own with your friend group or in your home or whatever? So with that, I just want everyone to have that mind's eye as we walk through today. And then I'm looking forward, and I'm excited as well. As Jack mentions, a couple of years of doing this, and I feel like each year, you even if you see something similar, you also see something different because our perspectives change over time. So that being said, just like Scarlett said, I'm the Director of Prevention. And so what does that do? My focus is on substance use prevention, okay? So what I want to start off with is give you all some context. I know many of you all are students or professionals, and so you see what's going on in the state. So I want to make sure I frame it from, hey, here's what the most recent data shows, and then speak from the Office of Prevention perspective in terms of what are we doing and how are we trying to attack it. So starting off, let's look at substance use in Tennessee. So what I can speak to here is what our department, the Tennessee Department of Mental Health and Substance Use Services, does as it relates to substance use treatment. As you can tell, since FY20 or FY12, we've treated more people ever, year over year, every single year so far, even in a COVID year. Now, mind you, this is FY20 because we're still finalizing our data for 21, and that won't be released until November or some point. But you can see here where we've served almost 22,000 people in FY20. Now, when you think about that 22,000 people, as we go to the next slide, then you can see the distribution of substance use. Like, why are people coming into treatment? What is their substance of use? And so if you look at it year over year, oh wow, what's been increasing every single year? Opioids, okay, which this is an opioid summit, right? You can see a decrease in people are not, simply put, people are not coming in at the same rate as before for alcohol use. That's decreased since 2012. But if you'll see what's really been rising at the highest rate out of everything, methamphetamine and stimulants. So if you think about what's going on in our state and what are the biggest issues as it relates to substance use, it's those two. It's methamphetamine, stimulants / opioids, or it's when those are polysubstance use. because for the most part, either things have been level or going down. Every single one of these has gone down except for methamphetamines and opioids. So I hope that gives you some context as to where we are in this. And as Jack talks, it does seem to be getting worse, but it is these groups that it's getting worse in. The other groups actually we are improving somewhat, even if it's just a little bit. So then let's take it from the substance use treatment side to then, okay, what are the outcomes for people who have substance use issues? And drug overdose deaths in 20 increased by 45% year over year. I can't say it's all because of COVID, but what I can say is as we looked at the trend data, there was a pretty big bump when COVID was at its worst in the state, and it's gotten a little bit better since then. But as we take away from the overdose deaths, I mentioned before when we looked at that treatment data, what's gone up? Opioids and stimulants. So as you can see here, what type of opioids? Pain relievers. Since 2016, it's down on a nominal level. I mean, it was 739 in 2016 overdose deaths from pain relievers, down to less than 600 in 2012. And I would say some of that, I believe, is due to the work of the Department of Health and Social Services, the Department of Health, and even an overall effort by the state to look at prescription drugs and how can we help provide information, help support people who may be misusing prescription drugs. But again, overdoses went up. So I'll talk about the good news. Hey, we're doing better on pain relievers and prescription opioids. Fentanyl. Fentanyl is the issue as you look at the increase. And when you see how I said we went from 2,000 or so to 3,000 overdoses year over year. Look at fentanyl. Fentanyl went from 1,087 in 19 to 2,014 in 2020. So not that you could just say, well, 1,000 more, it's just all fentanyl, but it sure does look like it. And so a lot of that is us at the state, and then you all at the provider level, at the local level, think about how do we attack the fentanyl issue in our state? How do we, structure services, provide information, and really help people who may be knowingly or unknowing misusing fentanyl? Because fact of the matter is, it is mixed into other things. I know we had an advisory or a press event last week where we talked about how it's been mixed in counterfeit pills that look just like real ones. You wouldn't know the difference. And I know sometimes we'll say something to the effect of one pill can kill, because the thought process is you don't know how much fentanyl is in that counterfeit pill. So some of our prevention messaging has been around that in terms of knowing if it's counterfeit or not, but then also not taking something that isn't a direct prescription for you. But then it's moving from just that one pill can kill part to then also expanding it to where fentanyl can be in other things other than illicit prescription drugs or counterfeit prescription drugs for lack of a better definition. So then I mentioned opioids, but now let's look at stimulants. Stimulants also have gone up in terms of causes for overdose in Tennessee. As you can see here, we went from 413 in 2016 to 1315 in 2020. No, it did not have such a great increase as fentanyl, increasing or doubling more or less year over year, but still that's an awfully big jump from 910 to 1315. That's about what 40 something percent, 40 to 50%. And so again, these data help us think about what we need to do or where we need to go with services. So let's make it go to a little bit more recent stuff. And then after this slide, this last slide will be like this. Now I'll talk about the services part, what we're doing in the Office of Prevention. You can see here's some good news. I try to end on some good news is when you look at hospital reported coded overdoses, opioid overdoses by month, year over year, we're down. We're in a better place this year at this point, well, as of August 2021, than we were at this point last year. So that's an encouraging piece. You can see that peak because this blue line is from 2020. You can see that peak from May of 2020 when, again, COVID may have been its worst in this state. And you can see there was a steady decline last year after that point. And you see this year, we've not gotten to the highs of where we were last year. So we're fortunate, mind you, the year's not over. I'm knowledgeable about that, but at least as it speaks to right now, that's what's going on in our state. Also, as you look at age groups, many age groups are down year over year, but let's be realistic here. Not every age group is down year over year or in the month of August. And so some of it is thinking about how do we reach, for instance, these individuals who are 45 to 54, because they're up a fair amount, 25% or so, when you look at the previous month from the previous year. So that being said, that's the data piece. And a lot of what this data does is, and it doesn't even come from my department. I'm hopefully you saw many of these slides come from the Department of Health. How do we take this data? How do we use this to do work? So then let's talk about the Department of Mental Health and Substance Abuse Services. And many of you maybe have seen these slides before. We like to think about what our mission is and what is our vision. So what's our mission? To create collaborative pathways to resiliency, recovery, and independence for Tennesseans living with mental illness and substance use disorders. Okay. And so when we think about that mission, what I really think about then is where does my office fall into that, right? I'm a part of this department. It sure doesn't say prevention up there, but it does. It does say prevention because we can be found in that building the collaborative pathways, building those relationships. You saw Jack talk about the role that they play with the SSP. Well, that SSP didn't just manifest itself out of nothing. It's where he worked, his team worked, the coalition worked with people in the community to build that up by way of a collaborative process. I also find the Office of Prevention in that resiliency piece, because I'll always say this, and if there's one takeaway from this whole presentation, take this away. Our job, my job, even your job, believe it or not, is to work to increase the protective factors of individuals around you or even yourself, and also working to decrease the risk factors. There are many ways you can increase protective factors. I think a lot of it is, well, I'm the director of prevention in the Division of Substance Abuse Services. It may not be something that's substance use prevention focused that is involved in building up those protective factors in individuals. And then when you look at our vision, a state of resiliency, see that word again, state of resiliency, recovery, independence in which Tennesseans living with mental illness and substance use disorders thrive. That's where, again, we want as a department, but even as a component of state government, to work in collaboration with other components of state government to reach this vision. Because I think we know, while we play a role, I think we play an important role. We're not the only people out here doing work. As evidenced by the 174 people or so who are here today, you are out there doing work as a part of my department or not. So then how do we do this together? So let's talk about some evidence-based prevention. What's prevention? It's pretty straightforward. Prevent, right? It's in the word. We want to prevent use of. We want to put people in a position where they don't develop those negative consequences from substance use. Because fact of the matter is if you can engage someone at an early age, guess what? You can prevent consequences further down the line. So this is our little, I call it a fan. I don't know if that's really appropriate or not. It's I don't know, what is it? It's that I can't remember what's the phrase in when for geometry. I wish I could think about it. Anyways, but this is the fan, and you can see much of the work that comes through my office is kind of shaded in blue. Okay. So if you were someone that said, hey, I want to be involved in prevention, these are the populations you work with. Now, it's okay if you don't want to be in prevention. If you want to be in treatment, that's fine. If you want to be in recovery, that's fine, and work with individuals who are seeking that. But when I think about my office, we try to think about ourselves in terms of buckets and how are we doing this prevention part. Lately, and I'll mention it, I'll go over a little bit later, we've gotten into doing more around case identification and referral, or even what I would call more of the tertiary prevention, or as SAMHSA, our major funder, likes to call intervention. So starting off, who should we focus on? Youth. I know I showed some data that shows some age groups where, hey, there are older individuals that we could focus on as well. You're exactly right. But as we think about a main focus, is that if you focus on youth, you'll have that kind of long tail positive outcome, right? Where it's working to educate, provide information, provide support, so that when an individual, when the parent's not there, when maybe they're away from their friend group, or they're with their friend group, people are able to make informed decisions able to understand potentially maybe repercussions, and not be in a place where um, it's almost feeling like, hey, I have to do this because. No, it's provide those supports so that they're there to make a good decision. Fact of the matter is if you can engage and stay engaged before 24, what half of all lifetime cases start before age of 14. So if you're able to keep on engaging, you decrease that by so much to where at a certain point, um, you don't really have to worry about them as much when they're 45 or 50 because they had those good habits developed at a younger age. Perception of risk is so important. Um, and it's not, I always worry that people think of prevention and they think of, oh, scare tactics. Let's scare them into, no, scare tactics from an evidence-based perspective have been proven to not be as effective. And so that's where it's where our focus is working on to educate and inform. So when we talk about populations, and you saw on that fan, you probably saw indicated, selective, and universal. If you've seen these slides before, I'm sorry. I try to do an intro part for those who haven't seen them. But let's start from the bottom of the triangle, work our way up. Okay, you guys. So from a universal perspective, it's everybody. Okay. You know, not directed to a specific risk group. It's more or less that's what the coalition does a lot of work with. Now we get to be more targeted when we think about selective and indicated populations. Selective individuals at higher than average risk of substance use, but then that indicated piece, or hey, they may be already using or engaged in other high risk behaviors. And so our goal there is to kind of get them back, or hey, work with them now because you may not be able to work with them at that level later. So I've talked about the kind of these first parts of the fan. So now I'm going to go over the harm reduction piece, that's getting out of that prevention piece, and then tertiary prevention / intervention. I think some people, it's not prevention. Well, it's over prevention. I think it is. So harm reduction policy models are an alternative to drug-free only campaigns. I mean, simply put, is if an individual is actively using substances and they're not in a position, or they're not interested, for lack of better phrasing, in seeking treatment or being in active long-term recovery, what are we supposed to do? Just give up and say, okay, well, I'm gone? No, we need to support them. We need to help inform, provide resources, continue to work with them until they're ready. Because research has shown treatment is most successful when an individual wants to do it, not when they're just forced to do it by external factors frequently. And so harm reduction can include a lot of different things. It could be courtesy rides for youth on prom night, okay? It could be distributing needles, unused needles, individuals who use substances, and even naloxone distribution and education, and potentially distribution campaign. Now, these programs can be controversial, and I completely understand. But the argument I always have with that is, well, if an individual is no longer living, how can we help them then? And that's kind of one of those things where I hate to be that simplistic with it, but you got to keep people alive, support them however you can in any given moment to provide an opportunity to get them on the pathway to long-term recovery. So that being said, let's talk about some programs for individual populations. It's that selective and indicated component that work talked about earlier. In the Office of Prevention, we do this through TPN, Tennessee Prevention Network, where we have a comprehensive ATOD program, comprehensive alcohol, tobacco, and other drugs program. We've got a program with Nurses for Newborns, where we work with infants, mothers who are at risk, maybe mothers who had substance use issues prior to or during their pregnancy. The goal here is really to support that child, but then also help that mother build up the protective factors and be in a position to, raise that child in an arena in which there isn't substance use going on. And it's other session-based, evidence-based program. I always joke and say that these are the butts and seats program. These are the dosage and duration. And when that work is done with fidelity to the model, you reach an expected outcome. And that expected outcome is to educate and build up those protective factors to prevent substance use later in life. So counties, not every single county is covered. You'll see here, Shelby County, look at that. There are a couple programs in Shelby County which offer these type of services. And I would say, as we think about prevention, it's not the most glamorous field in the world, but it is one of those fields that as you interact with individuals, you can kind of see, oh wow, hey, I was able to get them from where they were at the beginning to the end. And that's the kind of the interesting about the TPN program is you work with all different types of youth, right? And as they work through this program, you can even just see how they've learned, how they've grown as they receive these services, which is kind of exciting to me, to tell you the truth. Let's see, let's talk a little bit more about TPN. I talked about this a little bit, so I might walk through this a little bit more quickly. But our focus is primary prevention, doing our best to engage before. Um, and so here's some of the things going on in Shelby County. We have Pyramid Recovery Center. They're doing Botman life skills. These are all evidence-based practices. We don't do any of these where, oh, I think it's good, so I'm going to do it. No, no, our focus is on evidence-based services. Shelby County Schools does positive action, and the University of Memphis does sports to prevention plus wellness. Let the circle be unbroken, rites of passage curriculum. And you can see here where these are all different curricula, but these agencies identified these as the evidence-based strategies they wanted to do in their respective communities because of research and identifying needs and also what would work in their community. So now we're going to move from the individual based part to the universal part. That's that next bucket. And so what's a universal? It's the substance use prevention coalitions. Jack White, he's the executive director of one of them, the Shelby County. We've got about 46 others that are funded through my office. So what are coalitions? It's groups of people that come together that have a common thread or common interest, and they collaboratively work together to solve problems in their community. Because at the end of the day, you want your community to be a good place, right? You live there, right? Well, that's the place you want to be, to see improvement in. So I'd rather improve my community than somewhere else. And so these coalitions that are funded through the Office of Prevention, they focus on substance use prevention. And as they focus on substance use prevention, all of them use the SPIF. The SPIF is a framework, it's a model. It's a way in which it's an evidence-based way in which we can make sure that not necessarily all needs are met, but all angles are looked at as we plan events, activities, and try to do good work in a community. So there are 5 steps to this. I'll go over the fan in a second. It's another fan, but it's a full fan. It's not a half fan this time. And so as we look at the fan, these components: assessment, capacity, planning, implementation, evaluation, while always keeping in mind sustainability. How can we make this thing last longer than just this one shot? And cultural competence. Cultural competence is extremely important. It's always been important. It's not just important now, it's always been important, where we want to make sure that we're not coming into a community and doing something that just doesn't mesh. And so that's where, as we do an assessment, we want to make sure, hey, is this being done in a culturally competent and with cultural humility? Are we doing something that makes sense, for lack of better phrasing, in a respective community? So that's where I always joke and say, it shouldn't be Tony Jackson coming in and telling people what to do. I don't live there. I don't know what is best or what fits in your community. So that's where our community partners across the state do a great job of having the key sectors involved in the planning process. So it's not just one person doing. It's seeking the feedback and thoughts and perspectives from others as you go through this SPIF process. So what do the coalitions do? So they do implementation plans, for lack of better phrasing. These implementation plans are structured around: how do I prevent binge drinking in my community? How do I prevent tobacco use in my community? How do I prevent non-medical prescription drug use and or opioid use in my community? You saw me mention fentanyl and opioids earlier. How do I prevent marijuana use? And then also, how do I prevent stimulant use? The good news is we've been able to expand this from those first 3 bullets, those first 3 goals, to these 5. I feel like this gives us a pretty good comprehensive mode of attack, for lack of better phrasing. Because previously, without doing work around marijuana from a youth perspective, that's something we want to educate on, work to increase perception of risk, work to build up protective factors around that. But then also the stimulant use, because of what we're seeing in the data where we're seeing, oh, wow, more deaths can be attributed to this. Okay, what can we do beforehand to prevent stimulant use in our state? So looking at this map, we've got coalitions all over the state. I believe we're to where, while this is not the whole state, and you'll see, well, wait, hey, if you have 95 counties, you've got 46 that are funded through your office. Oh, wow, that's 50 counties you're missing. Well, 49. And to that, I would say you're exactly right. But the good news is many of our coalitions work outside of their county, maybe with mentoring or supporting other coalitions. But then also B, these 46 counties that have a coalition represent about 76% of our state population. Now, that being said, we do want to add more when we can. And that's something that we're interested in doing as funding allows. So what's going on in Memphis? You talk about MAPC for a second, Memphis Area Prevention Coalition. They work with local health department. That's a partner, right? They work with Mothers Against Drunk Driving, and they participate in Take Back Day. They do events like this. They do stop events and across the county, and that's again where it's the coalition doing work in collaboration with. I think Jack will readily admit this. It's not just the coalition doing it. If that's the case, it'd have a much smaller reach. It's really those partners that help coalitions in our state be successful. So then just looking at some other data, we do the TN Together student survey. And so correlation is not causation. We've all heard that phrase before. But what I would say is I look at these data and I'm kind of excited in that I feel like much of the work of these coalitions across the state is having an impact. In that, hey, pain reliever misuse is down 50% since 2012. Tobacco use is down almost 40% since 2012. Binge alcohol use in the past month is down 26% since 2012. And so no, I can't say the coalitions are doing all this work, but I do think they play a role. And that's where we want them to continue to play a role, because even though these numbers are going down, even though it seems in many instances we're below the national rate, we use that as kind of a measure to kind of see where we are. But fact matter is the work, there's still work that needs to be done. There's still work that can be done, and we'll be here for what I assume is a while. So another thing that we have going on is the higher education initiative. This is where we focus on, if you think about higher ed, you think about college, what do you think of? Well, alcohol use, potentially marijuana use, and other substance use. And so how can we be at a college level providing support? Again, it's not just youth, it's not just older individuals. We're trying to have a comprehensive approach. And so they work to target these things at the collegiate level. And so we work with CHASCO, which is the Coalitions for Healthy and Safe Campus Communities. And they do work around high-risk drinking behavior, drug use and incidents of violence. And then this past year, we added HIV and STI prevention in relation and correlation in conjunction with substance use prevention. Because as we all can imagine, at that age or at when kids leave home for the first time and may be exposed to substances, even if they had information and had their protective factors built up, there's still an opportunity to engage and support them at that level. And in fact, the matter is people don't make the best decisions when they're using substances. So this is where we're excited that we're able to add HIV and STI prevention to their list of work connected to substance use prevention. So primary objectives are pretty straightforward, right? How do we promote a healthy and safe campus community? How do we provide primary prevention services? And how do we connect and support those institutions? I mean, some of it is even just a resource piece. So these schools, these campuses have implementation plans that spell out how they're going to do these things. My team reviews these and works with them to figure out what's the best way of moving forward. So then here are some counties served by CHASCO. You can see, again, it's not the whole state. We don't have funding to do everything everywhere. So we do offer our office services where we can. So I think Scarlett mentioned the SOR funding. And so here's what we're doing with SOR in our state. SOR focuses on opioids and stimulant work. So what do? We try to provide trainings in every county um, to help educate, provide awareness to first responders is at high risk and agencies and organizations um, that work with people who need help. We're implementing an advertising media campaign in partnership with the Department of Health. They actually developed them, and we help distribute these resource guides that kind of would help. Hey, here are where resources are in your respective community. Another piece is train on and even distribute naloxone to individuals who are at risk of overdose. It's something to where that's been an important part of the work that we've been able to do with this funding is get more education out there, reach more people, but then also, and there's a high risk of overdose who don't have a means through which to access naloxone, provide that to them. In conjunction with our partnerships and or truthfully partnerships at the county level, work to coordinate response to overdose outbreaks. I know specifically in Shelby County, the ROPES, Regional Overdose Prevention Specialists in Shelby County, work with the health department. I think it's the consortium. I can never remember what the name of it is, but there's a whole group that this is where the data comes in, and then oh wow, hey, we can be a part of that response, which is a great thing and a new thing for us. And let's see, work to train healthcare professionals and students to assess and treat OUD, and then also increase access to MAT, medication assisted treatment. That's not done through my office. I'm director of prevention, not treatment, but it's also how do we support people who have an opioid use disorder. And this is one of those harm reduction techniques. This is not abstinence only. Um, so let's see, let's talk about the ropes specifically. We've got ropes across the state. I always say 20 to 24. I do that because like there's full-time, part-time, and it's how well, I'm not going to count half a person, it's still a full person, but it can range depending upon where we are. We try to make it statewide because there's no value in just focusing on urban or just focusing on rural. It has to be a statewide effort. So what do the ropes do? They work to educate on harm reduction, they work to reduce stigma, and they work to increase public awareness. Now, how do they do that? Okay. So harm reduction, I mentioned it before, but simply put, meeting people where they are. Okay. Not everyone is ready or able to stop drug use. And so what's the evidence-based way to support them in that moment? Harm reduction core principles, it's a non-judgmental approach. If you're over here judging people, they may not be, you may turn them away. And that's exactly what you don't want to do in that instance. And so understand that it's not a light switch. It's not going from 0 to 60 in 2 seconds. It may be incremental, and incremental is fine. It may be sometimes 2 steps forward and 1 step back. That's okay. It's where you're going and then how you get there. But realizing it may not be as fast as anyone wants it to be, but work to move forward. Focus on enhancing quality of life. It's understanding that there are a lot of different things that can impact drug use. Is it just one thing? Maybe, but not always. And so understand it's complex and understand that even getting someone to where they are no longer using substances or they're ready to receive treatment or be involved in treatment, there may be factors that just, aren't going to be overly obvious. And so maybe don't make as many assumptions. But then also empower individuals who use drugs. Help them understand, hey, you're the person. You're the one that's there that can help reduce the harms of your drug use. So that's the harm reduction side. So then also we work to reduce stigma. And I'd say, I think the one takeaway I said to you all was, hey, think about how you can increase protective factors and decrease risk factors in your respective community. The next takeaway would be reducing stigma. It's how we talk. It's what do we say and how do we say it. When you talk to people, they listen. And if you talk to them in a way that's biased intentionally or unintentionally, if you don't use person first language, if you label them, if you do any of those things, it might not be effective. So how do you find a way to not do those things? You focus on how you talk and how you engage people. I'd say a great resource. I don't have a link here, but NIH, National Institutes on Health, has a great Words That Matter pamphlet. I know our Ending the Syndemic friends have developed a document that speaks to language and stigmatizing language. I'd recommend anyone on this in the state look at those resources. And even if you feel like you don't use stigmatizing language, I'd say you're the first person I think should read. And then obviously, if you do use stigmatized language, I'd say look at those type of things, because a lot of it is again, you may not know. I would say I personally make an effort to review language documents and how I should talk on a regular basis, because fact matter is A, it's not going to hurt, right? And B, I feel like being familiar with and look at these things, it helps build it into how you operate. Now, I'm not saying go correct people if they're not using the right language or what you term the right language is, but at the same time, I would say be mindful of how you talk to people, and you can see how much of what I've talked about today, it could be applied to substance use, but it could be applied to anything. So that's where I think that's not a bad thing for me, just as a person to be aware of as I operate through this world. So another piece, working to increase public awareness. How do we do that? We do it through trainings. We do it through a media campaign. And what we've done is we've allowed our partners to individualize their media campaigns to make it tailored to their community. Okay. As we think about these trainings, you can see these are 4 key components of it. Talk about the opioid crisis, give the context around what's going on. Talk about harm reduction, because it's new to many people. I already mentioned stigma, so I won't talk about that as much. And then help people understand how to administer naloxone, how to be covered under the Good Samaritan law, and be certified, have that certification. That's important to make people feel more comfortable about doing it in a time of need. So what all have we done through the TN Save a Life, the ROPES program so far? We've distributed about 232,000 units of naloxone across the state since October of 2017. I think this is current as of the end of September. I think that's where Kate and I decided that's the number at the end of September. And I want to say, as we look at these numbers, I talk about those units, that's a statewide effort. It's not me doing it, it's people across the state doing it. But the other piece and the important number is this 30,000 number that we have. While we've distributed, more than 230,000 units of naloxone, we've got recorded 30,000 lives saved. That's great. That's awesome. And it speaks to our partners. It speaks to you all. It speaks to everyone. But I think the frustrating thing with all that is still, oh, wow, it still works. You saw the slide earlier where we went from 2,000 some odd overdoses. Those are 2,000 people. It's not just a number, to 3,000 people, a 45% increase year over year. And so a lot of it is understanding that it is people, and it's not just a number, and continuing to do more as we can. So with that, some things that are going on in Shelby County, I mentioned the STOP events, Street Team for Overdose Prevention. I think these are I think they're quarterly, but I can run the gamut. Partnership with Syringe Service Programs. I believe Safe Point in a Better Way are in Shelby County. I know the ROPES, and I know MAPC works with them, and they work with our Department of Health. And then fact matter is working with other populations. You can see this list here, but I'd say this isn't a comprehensive list. I think they work with as many populations as possible. Even if you don't think a population has an issue, that doesn't necessarily mean that's the case. So I think I've got 2 more slides. You all are almost done, I promise. One slide, what's something I could do tomorrow if I really want to, not tomorrow, Saturday. So in 2 days, Take Back Day. Take Back Day is on October 23rd. It's a national thing. It's not just that our state decided to do this. The DEA does this twice a year. They do it in October and they do it in April. And so Take Back Day on the 23rd. If you're interested in disposing of unused prescription drugs, if you're interested in disposing of maybe medical supplies, that's something that you can do on October 23rd. And so I did not pull the locations for Shelby County, but if you go to tntogether.com/takebackday, the first thing you'll see is a map with locations. And I know that between my team and our friends at the Department of Health and our friends at the TN Together website, we're working to make sure that's as up to date as possible. So that's the third takeaway from today. Okay, you guys, it's working to increase protective factors, decrease risk factors. It's think about stigma and language that we use. And also Take Back Day is on Saturday. So with that, here's my contact information. If you want to reach out and learn more about the Office of Prevention, if you want to even just learn more about what we're doing in relation to treatment and recovery services, I'll likely ferret you to Linda McCorkle or Rebecca Provo-Simmons because they're over those other areas. But if you're interested in any of this, please don't hesitate to reach out. As I mentioned before, it's not just us doing it; it's all of us. And if you have any interest in being involved in this work, please let us know. And with that, Scar, I think I'm on time, or maybe I'm a little under schedule, so I apologize. But that's
No,
it
you're
for
right on
me.
time.
Good for once. Shock amongst all shocks. Ooh, so Scott, what's next? Am I supposed to go through these questions?
Yes, so Olivia will read out the questions for you.
Perfect. Thank you, ma'am.
You're welcome. Can you see me?
I can. Hey, Olivia.
Hi, how are you?
I'm pretty good. Can't complain. Today's a day.
Good. Well, thank you for going through that and taking your time out of your day to, go through this with everybody. We really appreciate it. So now I was just going to go through a couple of questions that people sent in through the Q&A. So one person wants to know a little bit more about the fentanyl test strips and how that could be beneficial to our area.
Sure. Now, fentanyl test strips, it's one of those things to where, truthfully, I think they have some value. I think it helps educate or inform or provide information for people. I do know through our federal partners, they put an edict down that, hey, some, not all, some federal funds can be used to purchase fentanyl test strips. I think a lot of it is it just fentanyl test strips and that's it, or is it fentanyl test strips and other supporting information, other resources, other documents, and things like that. So I think fentanyl test strips all by themselves, oh wow, no, let's have some maybe other education pieces with it. But I think they can play a role. A lot of it is you think about these things, you think about the pros and cons. What are the pros? People are aware of what is in that. What is the con? It could be misused. But at the end of the day, it goes back to what I said before, was we cannot help people if they're no longer here. I don't mean to laugh when I say that, but you cannot help support somebody if they're not alive. And so if that's a tool that can be used, I think it's something that can be used situationally to provide some information that you wouldn't have had otherwise.
Thank you for answering that. Another person wants to know about how COVID has influenced the overdose death rates this past year.
Yeah, it's hard because do we have data that shows, all these overdose deaths happened because of COVID? No, but what I will tell you this is Tony Jackson talking as someone who oversees programs in the Tennessee Department of Mental Health and Substance Use Services. I would say overdose could have been impacted by people feeling isolated, feeling alone. I mean, research has shown an increase in substance use during COVID because of the lockdowns, because of even economic stress, and just some of the uncertainty going on around people. I know during COVID, many of my programs were stuck at home, for lack of better phrasing, for certain parts of the year. That's not how we design these programs to operate. Many of these programs are face-to-face programs. These are programs where you engage individuals. As we talk about the ropes and what they do, we were doing predominantly in-person trainings, naloxone distribution in person. During COVID, at some point, some of those things we tried to make as short a period as possible, but some of those things maybe went away or they looked different. And so some of it is really just going back to where things weren't always available as they always had. Now, that being said, I think we're operating more or less at 100% now. And so that's where we're trying to be available to people, provide resources, provide support to people who need them.
Great, thank you again. Another person has asked, how does giving out Narcan and sterile syringes, how does that influence the quality of life for a person who still injects drugs?
Sure. When you say the quality of life, it goes back to that harm reduction concept, right? Meeting people where they are. If they're selectively using substances and they haven't stopped using substances, their quality of life, simply put, they're still alive, right? But it's making sure it's not just giving naloxone, it's not just giving syringes, sterile syringes. I appreciate saying sterile instead of clean. So I can tell that you know your stuff. You know, clean's not the clean is a stigmatizing word sometimes. And so what I would say is doing that in conjunction with resources, connecting to other services potentially. I mean, I think about potentially even unhomed individuals who may access naloxone and sterile syringes. But also, what else is it that we can do to help support them? Does it work to help them get housing? Does it work to get employment? And those type of things. So a lot of it again goes into it's not just naloxone and syringes, it's naloxone syringes um, and it's also even communicating, having that a relationship, talking, and figure out how else can I support this person? How can I help? Because fact of the matter is if you're using substances, you're there may be adverse effects to that. So how do I reach them? And but I think naloxone and sterile syringes play a role in that. And that's really it, knowing that those aren't the whole solution. They're a piece of it, 100% yes, but it's not the whole solution.
Great, thank you. Somebody else wants to know a little bit more about just how social media is a factor in overdoses.
Yeah, no, I think social media plays a big role in this. I joked with somebody yesterday and I said something effective. I don't believe in Facebook. I'm like, what do you mean you don't believe in Facebook? I won't have that discussion today. But what I will say is social media, as we think about it, it's a communication tool that for lack of better phrasing, you may not have a lot of control of. And so then it's how do we leverage that? How do we maybe engage people in that way? Because what I try to think about is while social media may play a role in people doing things that they wouldn't do otherwise, but wait, how do I leverage that to maybe reach those individuals, provide education, provide support, connect to resources? And so some of that is taking, there are negatives to everything. So I'm not saying social media is the worst thing in the world. There are potentially some things that are worse than social media, but fact of the matter is recognizing, understanding that's there, and then how do we use it to our advantage? I know many of our providers do a lot of work around social media. The fact is that's how you can reach certain populations most effectively. And so again, it's how do we bend that to our will? How do we make that a benefit to us? Because if you just try to kind of put your head in the sand, that you'll likely be worse off in that regard.
Thank you. Somebody wants to know a little bit more about Narcan and what overdoses it helps with, and if there's any other overdoses that it's not effective.
Sure. Narcan. So what I try to do is I try to say naloxone. I think Narcan is the one a lot of people know about. Fact is currently that's the one that gets distributed through our program. So Narcan, simply put, it works. Narcan / naloxone. I'll probably say naloxone moving forward. Naloxone works in opioid overdoses. It does not work for a stimulant overdose. It does not work for if someone's intoxicated from alcohol. It works for opioid overdoses, and it does bring people back to life by bonding so that the opioid can't bond and all that stuff. I won't go deep into that. And so a lot of it is recognizing that, yeah, Narcan is a tool, but it doesn't just solve the overdose crisis in our state. Okay. You saw me mention that, oh, wow, we had 400 more overdoses related to stimulants year over year. We had 1,300, whereas we had, 2,000 fentanyl. So guess what? Naloxone plays a great role in preventing fentanyl-related overdoses. I think some of it is potentially the concentration, it's the strength of the fentanyl or its analogs, and also recognizing that if you are responding with naloxone, making sure you tie that with getting emergency services, first responders there, because simply put, you may not know if it's an opioid overdose. Fact of the matter is fentanyl is being mixed with other drugs, other illicit drugs. And so it may work for one of the illicit drugs that an individual is overdosing for, but it only works for opioids. I've heard people say it works for stimulants. No, it doesn't. It does not work for stimulants. Now, I always say the only way you can misuse naloxone is to not use it. That's 100% true. But recognizing that it's not the solution to everything, and making sure that if you use it, reach out to first responders. It'd rather be safe than something else.
Anthony, you have been great. We really appreciate you taking the time to answer these questions. We have one last one for you.
Great.
Somebody wants to know, what do you think your biggest accomplishment has been in battling this opioid epidemic in Shelby County?
The easiest thing for me to say is, oh, wow, hey, it's this number and we've done this. I think that's important. It could be also something to the effect of doing an unprecedented, from a State Department level, providing an unprecedented amount of MAT, medication-assisted treatment service, or getting people into recovery, getting people into treatment. But I think A, it's a culmination of those things. But then B, I think a lot of it, as a director of prevention, a lot of what we try to do is put things in place, right? And so I go back to the relationships that allowed these things to happen. I think that's the biggest accomplishment, because without that, without building that in the community, without, for instance, again, the Department of Health in Shelby County, working with other partners, they do that stuff, but building that up, without people thinking, hey, we need to do something, these other things don't happen. It's kind of a domino. And so what I would then say is it's because of the people and their partnership. Now, I think all these things are important. I think it's incredible that we're over here saving lives every single day. Jack, he's right to say, oh, well, someone dies from overdose every day. But then I would also say, oh, wow, like 10, however many people are revived, or brought back to life every day. But I think the relationships are so important. And without that, nothing else happens. Truthfully, nothing else matters. So that's my opinion. I don't know. Maybe I should check with my boss before I answer questions like that. But I think relationships are so important for moving forward.
Thank you, Anthony. That was great.